Madam Speaker, Mr. Vice Speaker, member of the Board of Chancellors, members of the Council Steering Committee, counselors, family, members, and friends. It's an honor for me to present my first Chief Executive Officer's report for 2014. The college has truly been a very busy place and had a successful year in supporting radiologists and all members of the House of Radiology in our efforts to provide clinically appropriate, safe, high quality, and cost-efficient care. I'd like to begin by thanking the Search Committee, the Board of Chancellors, for their trust and confidence in selecting me to serve as your CEO. It will be an honor and privilege to work with you, our fantastic ACR staff, and our thousands of volunteers to continue the strong legacy of advancing the science and practice of radiology. In addition, I must thank my wife, Nancy, who has been incredibly supportive of this quantum leap change in our lives. We would both like to express our appreciation to ACR Chief Operating Officer Ken Karatke, all of our Executive Vice Presidents, Frida White, Amanda Zern, and all of the fantastic staff who have made our arrival and first 2 weeks a smooth and welcome transition. I'm pleased to say that I have not once reverted to my former life and attempted to insert a central venous catheter into any of the unsuspecting staff. Critical to the success of this transition is my friend and colleague, Dr. Harvey Neiman, whose support and guidance has been invaluable. Recognizing he is irreplaceable, one could not ask for a better mentor to assist in assumption of this position. We have heard from Dr. Ellen Mogan of the uncountable contributions Harvey has made to our college and our profession. President Harry Truman once said, "We are all eating from fields that we did not sow and drinking from wells we did not dig." Clearly, Harvey is one who sowed those fields and dug those wells. In the areas of government relations and economics, it has been a year of great achievement and ongoing challenges. As a result of a forward-thinking vision, a well-formulated plan, a coordinated effort of many segments of the college, and years of persistence by our leadership, volunteers, and government relations team, recently passed and signed legislation reversing the anticipated 24% reimbursement cuts to all physicians includes provisions designed and developed by the ACR to promote optimal Medicare utilization of advanced diagnostic imaging through the use of National Medical Society developed appropriateness criteria, such as those developed by the ACR. To mandate that CMS justify the recently imposed multiple procedure payment reduction on the professional component of imaging services, and to limit the maximum CMS payment reduction in any given year for any service. We will be hearing a thorough report from the economics group on Tuesday, but our challenges in this rapidly changing environment remain substantial. However, Dr. Geraldine McGinty and her entire team of physician and staff experts continue to work through the existing fee-for-service coding and reimbursement processes to ensure appropriate reporting and reimbursement of all radiology services. Simultaneously, with meetings as recently as April 14th, we continue to tap the talents of many stakeholders and partners in the investigation of potential and existing alternate payment systems. This will add to the spectrum of resources available to all members as you respond to your local practice environment. In addition, this analysis will be incorporated into the Imaging 3.0 initiative, our roadmap to the future of radiology care delivery. Following the U.S. Preventative Services Task Force recommendation regarding lung cancer screening, based on the Akron-performed NLST trial and other studies, the ACR Economics Commission has coordinated an excellent presentation to the coverage group at CMS. They recruited the support of over 50 medical societies, patient advocacy groups, and others. And we await the anticipated CMS ruling regarding a coverage determination. But that said, all practices and departments should be preparing programs to provide this effective tool for screening high-risk individuals. Though there's been a delay in the implementation of ICD-10, the college has created resources for all members to prepare for this major change in your practices. You will hear a full report from our Secretary-Treasurer in a moment, but in brief, the college has had a successful year in operations, but our commitment to capital expenditures has resulted in an adjusted net loss. With the returns from our investments, however, we've experienced an increase in net assets of $13.6 million, and with this positive trend, you see over the last decade, the college remains financially sound. We must recognize, however, that the current level of operations, expenses, and capital investment commitments cannot be sustained by our current revenue sources. As a result, the board has initiated a strategic planning process to ensure accurate allocation of those resources appropriate to our mission and the goals to be determined in that strategic plan. Regarding research, the restructuring of the Cooperative Group Program by the National Cancer Institute that went into effect March 1st resulted in the merger of RTOG, our Radiation Oncology Group, and the oncology portion of ACRIN with other groups. As a result, the ACR is no longer the grantee for research by those groups. In addition, final funding in the current cycle has not been announced by the National Cancer Institute. Now, despite our efforts to come to agreement with the newly formed ECOG ACRIN and NRG, those merged cooperative groups, the absence of both definite funding and firm agreements on payments for ACR-provided services has necessitated the difficult process of right-sizing the research office in Philadelphia. We will continue to monitor this process and make appropriate changes. The ACRI educational efforts continue on multiple fronts, and I'll just mention a few. The Education Center enjoys the reputation of being a truly unique and powerfully effective experience. It has continued to grow both in attendance and in the scope of courses. The true measure is the positive feedback we get from attendees, with a large percentage returning for second, third, and additional courses. Our current record holder has participated in 9 courses at the Ed Center. All that just resulting from the scribblings on a napkin and an idea from Drs. Van Moore, Dr. Jim Thrall, and Dr. Harvey Neiman. The American Institute for Radiologic Pathology continues to grow and remains a cornerstone of the training of radiology residents. In addition, we've experienced an increase in categorical courses and international enrollment, further spreading the reputation of ACR educational programs and products. Despite its short existence, the Radiology Leadership Institute has already accumulated over 1,600 enrollees. Former Senator Tom Daschle was the keynote speaker at last summer's summit and is very supportive of radiologists becoming more involved in leadership roles in healthcare. We look forward to the address by Clayton Christensen and a first-class program this August at Babson College in Massachusetts. The RLI is providing the specialty with a growing population of radiologists with the knowledge and skills to lead their practices and departments, as well as our specialty, into the future. The RLI capital campaign has been extremely successful, exceeding our $5 million goal. This will provide scholarships for residents and fellows, ensuring their involvement, as well as supporting both program and technology development to optimize institute performance and results. Our thanks go out to all of our corporate and volunteer donors that, combined with the ACR seed money, resulted in our reaching this lofty goal. This truly is an investment in our profession. I think we're one slide behind. The ACR Quality and Safety Commission continues to lead in an ever-demanding world of healthcare accountability. CMS has created a new option for the Physician Quality Reporting System, the PQRS, with requirements that will allow qualification by participation in so-called qualified clinical data registries. The ACR has submitted a nomination to qualify our National Radiology Data Registry, the so-called NEAR-DEAR, and expect a determination in late May. Once qualified, practices participating in our registries not only benefit from comparing themselves to regional and national norms, but may qualify for ABR MOC reimbursement incentives in 2016. Radiology Info, now over a decade old, is a successful joint effort of the ACR and the RSNA, designed and functioning as the premier public website for information about radiology procedures and radiologists. During 2013 and early 2014, the co-chairs and oversight committee undertook a strategic planning process including focus groups and a professional usability study of our website. The new strategic plan was finalized at our meeting in February and will result in further expansion into mobile applications as well as more patient-centric focus. In addition, there are ongoing discussions to integrate access to this array of high-quality content into order entry software to promote increased use by our referring providers and patients. The array of complex programs supporting all 5 pillars of the college activity could not exist without our extremely sophisticated IT backbone. Our experienced volunteers and talented staff have created an infrastructure admired by all and recognized as a leader by other specialties, industry, and governmental agencies. There are multiple additional programs in development that we believe will integrate with order entry, PACS, and electronic health records to optimize radiology service delivery and better inform our patients regarding their care. Time clearly does not permit me to describe all of the college's numerous offerings and projects. I realize that I'm speaking to the choir here at the AMCLC, but each of you will be faced with questions from partners or other fellow radiologists, like, what is the ACR doing for me? Why should I continue to pay dues? My response is simple. Any radiologist, radiation oncologist, or medical physicist who can look themselves in the mirror and honestly say they believe they are not $20 per week better off as a result of the ACR's efforts on their behalf should not be a member. My first 2 weeks as your CEO has further affirmed my recognition that the American College of Radiology remains a busy, vibrant, and highly respected society and dedicated to our mission. Please join me in applauding all of the volunteers who work tirelessly on your behalf and the incredibly talented and dedicated ACR staff without whom none of these accomplishments could occur. Madam Speaker, thank you for the opportunity to give my report.